No. I'll do it.
Exec after the first bill.
We got Brenda Shields real quick, then exec, then the hearing.
Yep.
Okay. Good morning. Good morning. This meeting of the Committee on Government Accountability is now in session. Mr. Secretary, please call the roll.
Eslinger.
Here.
Brown. Beck. Black. Crawford. Mosley. Trent. You step.
We have a forum. So we have 3 bills to hear today. And before we start, just to see, can I see a show of hands of who is here to testify on 1488? Thank you. Testify on 1325? Thank you. And then 956. All right. So as you can tell, this is going to be a very busy morning. So we're going to bring up Representative Shields first. But I ask that if we have, when you come up to testify, to have your remarks to be succinct, and we're going to roll through these pretty quickly, okay? I want to give each side, opposing and support, the same amount of time so that we have a fair hearing. Okay? So, Representative Shields, you're here to testify, or you're here to present your bill, and you may begin when you're ready.
Thank you so much. Thank you, Madam Chairwoman and members of the committee. I am Brenda Shields, representing District 11 in St. Joseph, Missouri, and I'm here today to present the Child Care Tax Credit Bill. It's the exact same bill that Senator Lauren Arthur presented to this committee and debated for about an hour on the floor a couple of weeks ago. The program consists of 3 tax credits: the Child Care Contribution Tax Credit, the Employer-Provided Child Care Tax, or the Assistance Tax Credit, and a Child Care Provider Tax Credit. I am happy to answer any additional questions that you may have. Thank you very much for letting me be here.
Absolutely. Thank you, Representative. Are there any questions for the Representative? Seeing none. We will now have testimony in support of. Good morning.
Good morning. Kara Corches on behalf of the Missouri Chamber of Commerce and Industry, also in support. Like we were at the last hearing, we applaud the leadership of Representative Shields and Senator Arthur on this package. Child care is indeed an economic issue for the state to consider solving, and we believe this package helps a lot of different people, working families, businesses, and child care providers. Happy to take any questions you may have.
Thank you. Do we have any questions? Senator Black.
One question we'll try to answer quick. Fiscal note, Chamber of Commerce think that's probably pretty accurate. And on the back side of what we see in state government, I think you've provided numbers before, what your guesstimate is, what Chamber guesstimate is on economic growth. What are those numbers?
Absolutely, and thanks for the question. Yeah, our study found that the state lost out on over $1.35 billion annually due to child care issues. The direct hit to the state was a loss of $280 million. If a parent can't go to work because of child care issues, they don't get paid. They don't pay the state tax money. And so with the fiscal note, and I don't have it exactly in front of me, I know the 3 program caps are $20 million, so $60 million total. We think just by helping people go to work, it's going to be a plus up for the state in terms of if we lost $280 million and this cost $60 million, it's going to be a win.
Are there any other questions for this witness? Seeing none. Thank you. Good morning, Sam.
Good morning, Madam Chairwoman, members of the committee. Samuel Lee with Campaign Life Missouri to go on record in support of this pro-life bill, like we did on Senator Lauren Arthur's bill. Happy to answer any questions.
Thank you. Are there any questions for our witness? Seeing none. Thank you, Sam. Such a gentleman, such a gentleman.
Sometimes. Good morning, Madam Chair, members of the committee. I'm Kathy Harness here today on behalf of St. Luke's Health System, and we would like to go on record in support of this bill.
Thank you.
Appreciate it.
Are there any questions for this witness? Seeing none. Thank you. Good morning.
Good morning, Madam Chair. Shannon Cooper, this morning representing the City of Kansas City, the Greater Kansas City Chamber of Commerce, the Civic Council of Greater Kansas City, and United We go on record in support of the bill. Be happy to answer any questions.
Thank you. Are there any questions for this witness? Seeing
Thank
none.
you.
Thank you. Good morning, Robin.
Good morning, Madam Chairwoman and members of the committee. My name is Robin Shelp, Director of Policy and Advocacy for Kids Win Missouri, and we strongly support this bill and thank the representative for her work on this.
Thank you. Any questions for this witness? Seeing none. We're testifying in favor of.
Good morning, Madam Chairman. David Oberfeld on behalf of Associated Industries of Missouri, the Missouri Retailers Association, and the Missouri Grocers Association in support of the bill.
Appreciate it. Thank you. Any questions for this witness? Seeing none. Thank you, sir. Good morning.
Brad Jones with the NFIB. We would like to also register our support for this legislation. Thank you for the hearing.
Absolutely. Any questions for this witness? Seeing none. Thank you, sir. Good morning.
Good morning. I'm Kaylee Paffrath. I am testifying in support of this bill for Moberly Area Economic Development, Missouri Northeast, and MEDC, the Missouri Economic Development Council.
Absolutely. Thank you. Are there any questions for this witness? Seeing none. Thank you.
Good morning, Madam Chair, members of the committee. Stacy Priest. I'm representing Aligned. Aligned is an organization of business leaders with a strong interest in education, preschool, all the way through the workforce. So clearly this touches on several of our priorities, and we are happy to support the bill.
Thank you. Are there any questions for this witness? Seeing none. Thank you.
Madam Chair, members of the committee, can you hear me?
You're good.
My name is Jack Campbell. I'm here on behalf of the Missouri Alliance of YMCAs, and we would love to have the pleasure of going on record in support.
Thank you. Any questions for this witness? Seeing none. Thank you, sir. Good morning.
Good morning, Madam Chair, members of the committee. Bill Anderson on behalf of the Missouri Hospital Association. We'd like to go on record in support of House Bill 1488.
Wonderful. Thank you. Any questions for this witness? Seeing none. Next witness. Do we have anybody else who would like to testify in favor of? Do we have anyone who would like to? Whoop, we have one more.
Madam Chair, members of the committee, Chase Campbell, just going on record in support for St. Louis County, National Association of Social Workers, Goodwill Mocan, Kansas City, and Children's Trust Fund.
Wonderful. Thank you. Any questions for this witness? Seeing none. Are there any others who would like to testify in favor of? Do we have any who would like to testify in opposition to? Seeing none. Would anybody like to testify for informational purposes only? Seeing none. Representative Shields, do you have any closing remarks?
Thank you. I appreciate it this morning.
Absolutely. Thank you. So that ends the hearing for House Bill 1488. And now we will, we have a quorum. I'd like for us to move that we go into executive session. Do I have a second? Did you get a second? Okay. I have a motion and a second. All those in favor say aye. Aye. Opposed, nay. Ayes have it. We are in executive session. I now move that we bring House Bill 1488 before the committee. Do I have a second? Thank you. I have a second. The bill is before the committee. I move that we do pass 1488, House Bill 1488. Do I have a second? Thank you. This is now, we just heard Representative Shields' bill that we just heard. The committee has already voted out this version, which is Senator Arthur's version of 742 in January. Do we have any discussion on this bill? Thank you. Mr. Secretary, seeing none, Mr. Secretary, please call the roll.
Eslinger.
Aye.
Brown. Beck. Black. Crawford. Mosley. Trent.
By your vote of 5-1, you have voted do pass House Bill 1488. So now I bring Senate Bill 1048 before the committee. Do I have a second? Thank you. The bill is before the committee. I have a Senate substitute, and I move that we adopt the Senate committee substitute for Senate Bill 1048. Do I have a second? Thank you. This committee substitute reflects what the House third read on the floor March 7th. The bill passed by the House with bipartisan support, 145 to 0. This bill defines improper governmental activity, specifics that the auditor or the representative is allowed to audit any entity if, after an investigation, it has revealed improper governmental activity. It specifies that the testimony and records obtained by the subpoenas shall be subject to the same confidentiality and disclosure. Requires for audit work papers, repeals the requirement to duplicate an audit already done by insurance companies, and they need to only report the findings of the audit. It also adds records relating to reports of allegations and improper governmental activities to the list of records exempt from disclosure. This was Senator Fitzwater's bill that we had previously obviously discussed. Do we have discussion on the adoption of the substitute? Seeing none. All those in favor of adopting the Senate Committee substitute say aye. All opposed, nay. The ayes have it, and you have adopted the Senate Committee substitute. I now move that we do pass Senate Committee substitute for Senate Bill 1048. Do I have a second? Any further discussion? On do pass motion, Mr. Secretary, please call the roll.
Eslinger,
Aye.
Brown, Beck, Black, Crawford, Mosley, Trent.
By your vote of 7-0, you have voted do pass on Senate Committee substitute for Senate Bill 1048. I now move that we bring Senate Bill 1284 before the committee. Do I have a second? The bill is before the committee. I have a Senate Committee substitute, and I move that we adopt the Senate Committee substitute for 1284. Do I have a second? The committee substitute is the work of the Division of Professional Registration working with stakeholder groups. The committee substitute would empower the executive director for the Professional Counselor Board to approve clean licensure applications. Currently, the board members themselves have to approve all applications. This committee substitute would also require that the Division of Professional Registration put the license information for professionally licensed professional counselors online. Discussion on the adoption of the substitute. Seeing none. All those in favor of adopting the committee substitute, please say aye. All opposed, nay. The ayes have it. You have adopted the Senate Committee substitute. I now move that we do pass Senate Committee substitute for Senate Bill 1284. Do I have a second? Any further discussion on the do pass motion? Seeing none. Secretary, please call the roll.
Eslinger,
Aye.
Brown, Beck, Black, Crawford, Mosley, Trent.
By your vote of 7-0, you have voted do pass on Senate Committee substitute for Senate Bill 1284. I will mention I appreciate your all's patience as we roll through these. We have committee members that have to go to other committees, so we're trying to get through executive session. So now I bring before you the Senate Bill 1340 before the committee. Do I have a second? This bill is before the committee. I move that we do pass Senate Bill 1340. Do I have a second? As a reminder, this is Senator Bernskoetter's that we heard last week relating to emergency medical services. As we heard in the testimony from last week, the changes in this bill is to help bring efficiency to the administration of our ground ambulance services and to help ensure that adequate ground ambulance services are being provided throughout the entire state. Is there any discussion? Seeing none. Okay, because there's no committee substitute. So we're now ready to go to a vote. Mr. Secretary, please call the roll.
Eslinger,
Aye.
Brown, Beck, Black, Crawford, Mosley, Trent.
By your vote of 7-0, you have voted do pass Senate Bill 1340. So now we are leaving executive session. I make a motion we move out of executive session and resume our regular hearing. Do I have a second? All those in favor? Please say aye. All those against? Nay. We have left executive session and resume our regular meeting. So we have two bills left to hear today. We will start with Senate Bill 1325. Senator McCreery, begin when you are ready. Good morning.
Good morning. Thank you for having me here this morning. I'm State Senator Tracy McCreery, representing District 24 in St. Louis County. I'm here today to present Senate Bill 1325. This bill would allow registered interior designers, practitioners, to practice the full extent of their training and capabilities. I want to emphasize that interior designers do not want to be architects nor engineers, but they do want to be able to independently design within their existing scope of abilities. One of the reasons I am sponsoring this legislation is I do believe that upon passage that it would create lower construction costs and lower fees for private and governmental clients, And it would also help support small businesses. Many of these are predominantly women-owned businesses, quite honestly, so that was one of the interests that I had in bringing this bill forward. So I had a very productive meeting on Tuesday with architects and with interior designers. We had a really good conversation. I think some of that will come out today in the hearing. I do believe that there's middle ground in this language. We still have some work to do, and I just want to emphasize that I truly believe that everybody you hear from today deeply cares about public health, safety, and welfare. So that's kind of our jumping off point, and then we just have a few areas we need to work on moving forward. So with that, I'm happy to take questions, but probably more importantly, it's better to hear from those in the professions of registered interior designers and architects.
Okay, thank you, Senator. Are there any questions for the Senator? Seeing none, so we'll begin testimony in favor of. If they would please come forward.
Good morning, Chairman Eslinger and the committee. Thank you for investing your time today. My name is Megan Dudek. I'm a Missouri registered interior designer with a WBE status in the state of Missouri. I've practiced interior design for 25 years and have owned my firm for 12. Just like other licensed design professionals, registered interior designers are qualified by education, experience, and examination to design and coordinate multifaceted built interior environments and protect the health, safety, and welfare of the public, as well as enhance the functionality and aesthetic qualities of these spaces. We combine critical skills such as knowledge of codes, ADA accessibility, construction materials, creative thinking skills, such as space planning, documentation, and finish selection to serve the public and create a safe built space. Like other design professionals, we are also required to satisfy continuing education requirements to maintain our certification and registration. A personal experience that I can share is I contract with architecture firms that do not employ interior designers to perform specific services. Specifically, in the last 6 months, I've worked with 2 small architecture firms that did not sign my drawings during the permitting phase, so the city requested I personally stamp and seal. Since that is not possible, the 2 firms explained why the sheets weren't signed, reviewed my work, and accepted liability for information I created and produced. This requirement is to have another design professional review work that I am trained and tested to perform independently. Not only adds cost and time to the project, it also undermines the expertise and experience of interior designers who choose to complete the optional registration. Consumers should be afforded the ability to work with a registered interior designer for all work within the scope of interior design practice, from concept through permitting to project completion. This creates greater choice, competition, and increased quality in the marketplace for private and governmental projects. It creates diversity and equality of entry into the design marketplace for small business interior designers, many of which are women-owned. This bill would not affect any other design professional's ability to practice this profession. Please support Senate Bill 1325 and allow the interior design industry within our state to reach its full potential. Thank you, and I'm happy to answer any questions.
Thank you. Do we have any questions for this witness? Senator Black.
This bill has caused people to show up at my office
I'm sure.
and even call on my phone, and the senator sitting beside you probably says, I can't believe that. I want to know liability-wise, insurance-wise,
Sure.
primarily on interior designers, where are the parentheses within liability coverage that you folks, that we would expect a professional interior designer to have, not Rusty Black interior design?
So as an interior designer, I personally own my firm, and I have E&O insurance right now that covers any scope of work that I do, and it is, errors and emissions, thank you. Errors and emissions insurance, and it covers the set of drawings that I complete are identified by an ID, interior design tag on the sheets, and my errors and emissions insurance covers all the scope of work within that, and that includes non-structural and non-seismic projects that are typically performed by an architect or engineer.
Thank you. Any other questions for this witness? Seeing none. Thank you. Please leave your witness form.
Thank you.
Next up, who would like to testify in favor of?
Good morning,
Good morning.
Chair Eslinger, members of the committee. My name is Matthew Baruch. I'm with the Council for Interior Design Qualification. Our organization writes and administers the national certification exam that is required for registration or licensure for registered interior designers. And we support this bill because interior designers are qualified through the 3 E's, education, experience, and examination, to independently protect the public through their practice. As was mentioned previously, interior designers are required to undergo education and thousands of hours of experience to sit for the examination. It covers a wide variety of core competencies that are required to protect the public in our practice, and I have copies of the exam blueprints that go into extreme detail about what the exam covers if the committee members would like to take a look at those. Our exam ensures that interior designers are qualified to protect the public in their practice and understand how their work is impacted by other design professionals. These folks don't design spaces in a vacuum. They understand how to work with other design professionals and integrate their work with other design professionals. We regularly update the exam to make sure it's current. We require continuing education to maintain active certification. And I'd also like to note that states are increasingly recognizing the need for independent practice rights of certified interior design practitioners. Over the last few years, the states of North Carolina, Wisconsin, Iowa, and Illinois have all passed unopposed legislation that does exactly what this bill would do. And just last week, the governor of Nebraska signed legislation into law that does exactly what this bill would do. This bill borrows language from those bills as it was developed in collaboration between the architecture and interior design communities in those states. And as I said, those bills were not opposed there. So, the National Regulatory Associations for all the design professions unequivocally support the reasonable regulation of the interior design profession. And our organization is committed to protecting the health, safety, and welfare of the public. We believe this legislation would do just that. I ask the committee to support this legislation. Thank you for your time and happy to answer any questions you might have.
Thank you. Do we have any questions for this witness? We do. Senator Crawford.
Thank you, Madam Chair. And maybe one of you covered this, I just didn't hear it. Tell me again the education requirements for your position.
Yeah, through the chair, Senator Crawford, we require 60 semester or 90 quarter credit hours of interior design specific coursework in order to sit for the examination. That can be satisfied through a variety of different pathways. A bachelor's degree that's either accredited by the national accrediting body or a non-accredited degree pathway, an architecture pathway. We even have an associate's degree pathway as long as they satisfy that 60 semester credit hours requirement. I don't think that many associate's programs do, but we have multiple pathways for individuals to sit for the examination as long as they satisfy that requirement.
Okay, thank you.
Yeah.
Any other questions? Seeing none. Thank you, sir.
Thank you for your
Next,
time.
I'd like to testify in favor of. Good morning.
Good morning, Chairman Eslinger and members of the committee. My name is Kelly Kirtland, and I work with Lamar Johnson Collaborative in St. Louis, Missouri. I'm a registered interior designer. Thank you for allowing me to testify today in favor of Senate Bill 1325. Registered interior designers in Missouri are eminently qualified to independently design non-load-bearing, non-seismic, and non-structural interior design elements in all code-related spaces, and I ask that you support this bill to allow registered interior designers like me to practice to the fullest extent of our professional capabilities. Missouri registered interior designers require the education, experience, and rigorous examination to prepare to protect the public in our practice. We are trained and tested in numerous areas that affect public safety, including fire and life safety, building codes and regulations, ADA accessibility, emergency egress, and more. Senate Bill 1325 allows me, as a qualified practitioner, to take responsibility for my own work. from inception through permitting and to completion of the project. The Missouri Interior Design Council, which oversees registered interior designers in our state, would provide enforcement and discipline for incompetent practice, much like the current Board of Architects does. You may hear this morning from our colleagues in the design community that they worry about the health, safety, and welfare of the public, as do we. In fact, the primary charge of registered interior designers is to protect the health, safety, and welfare of the public. We work every day to design interior spaces of public facilities such as nursing homes, hospitals, schools, office spaces, and government buildings, mitigating hazards to public health and safety. Our dedication to protecting public health and safety is why this bill has a very specifically defined scope of practice that only permits registered interior designers to independently design non-structural interior construction plans. You may also hear that since architects and interior designers do not have the same education, experience, and examination standards, we should not be allowed to take responsibility for our own work. We are not asking, nor do we want to practice architecture. Our professions are unique and distinct, which has been researched and confirmed by the national organizations that write the licensure exams for both professions. Our purview is limited to non-structural interior construction, and this bill makes that clear. We are qualified and competent to work independently within our scope, which is why 17 other states provide permitting privileges to registered interior designers. Finally, I ask for your support of Senate Bill 1325, allowing qualified and competent practitioners to independently protect the public and their practice. Thank you, and I'm happy to answer any questions.
Thank you. Any questions for this witness? Seeing Senator Brown.
Hey, thank you for your testimony. You mentioned that this bill doesn't allow you to make structural changes.
That's right.
I was under the understanding that you might be able to move some walls and things of that nature. So how is that defined as far as what's structural and what isn't? Who gets to make that decision?
Well, there's, in our experience and through education, there are structural non-load-bearing walls and load-bearing walls. So we are able to move non-load-bearing, non-structural walls. Anything that would come under that purview of structure, that would go to that would be out of the purview of this bill.
Okay, and would that be the oversight body that you mentioned that would be able to weigh in on those, or would it be a municipality? Who would be able to make those calls?
It would be a municipality. I mean, normally, as well, we know what is structural and non-structural, so we're not looking to touch anything load-bearing. The minute we have a project where it would need to be load-bearing, that's out of our purview, and we know what is load-bearing and what is not.
Okay, thank you.
Thank you.
Any further questions for this witness? Seeing none. Thank you. Next, I'd like to testify in favor of. Testify in opposition to. Seeing none, do we have anybody who would like, do we have one? Testifying, we're open to testimony in opposition to. Good morning. Begin when you're ready.
Thank you. Good morning. My name is Laura Pastine. I'm a licensed architect in Kansas City. Currently, I am president-elect for AIA Missouri. We are the state board for the American Institute of Architects, and we're representing almost 5,400 licensed architects across our state. Today, we are here in opposition to State Bill 1325 on expanding existing registered interior design legislation to include signing and sealing privileges. As architects, when we seal drawings for permitting and construction purposes, our seal is not related to aesthetics. It's not related to the quality of our design, or even if we have the most efficient layout. The purpose of our seal is to protect the life safety in the public realm. Health, safety, and welfare of the occupants of our buildings is at the heart of the responsibility that we carry as licensed architects. Expanding that privilege to other professionals is our ethical
and professional responsibility to make sure that those groups also have the required levels of education, supervised experience, testing, continuing education, and oversight. In a scenario where a registered interior designer would be signing and sealing drawings to submit for permit for construction without an architect, those interior designers are not just authorizing their individual scope of work. It's not just their finishes and millwork and change of layout of walls. If there is no architect as part of that drawing set, they are taking on the responsibility of the life safety of that space. Even if that project has no change of use, as you look at some of the language in Senate Bill 1325, that does reduce some of the code implications of the work that would be under an interior designer's seal, but does not exclude the need for code work. Every set of drawings that passes the desk of a plans reviewer needs to have a code analysis and a code plan, especially with existing buildings, to show existing conditions of that space. So that is definitely part of the role that would be taken on, and that definitely is part of what is at the heart of what the architect's role is. We do have specific concerns related to the sheet that you all just got a copy of. We're going to start at the top related to experience requirements. Each of our groups have supervised required hours that we have after we leave school and we're new to practice. You can see there we list comparable hours. It's less about quantity and more about quality in terms of where our concern lies. We have almost 100 structured tasks in terms of our NCAR required supervised work. The language of those specific tasks is really specific, especially when it comes down to work related to life safety and the health, safety, welfare portions. We have specific language related to needing to complete code analyses and to complete code-related documentation as part of our drawing sets. When we look at comparable language in the CIDQ required experience, it's much broader language. There is a mention of life safety, but we don't know what that means in terms of if that is participating in a code study or if that means owning the complete code study and really taking on the ownership and responsibility of that work. There is also questions related to construction supervision and how we coordinate some of our technical consultants, like our engineering partners and our structural engineers. So I'm happy to answer any questions related to the experience piece.
All right, thank you. Do we have any questions for this witness? Senator Black.
As I've been learning about this and stamps of approval, I live in a very rural part of the state and represent a rural part of the state, and you know, a lot of things get accomplished there without much intervention or help. Where possibly in rural Missouri would your stamp be required to be able to do some kind of project?
Well, and that does depend on the structure of your municipality, you know, in terms of if you do have an authority having jurisdiction over your work. In that case, and I think that was brought up in maybe the last question as well, in terms of how do we define where our stamp or an interior design.
So probably in the area that I represent, there's not much stamp requirement to do anything because there's not these rules and regulations around.
Right.
Yeah, a few towns, but
Right.
primarily, okay.
So yeah.
Because I think most of our stamp of approval comes from a Lowe's or a local place that have a computer drawing thing, and they send you this picture and write a check for $15,000, take this stuff home and
Right.
put
So
it in the wall.
I guess we're speaking to apples to apples comparison where we do sign and seal drawings.
to make sure that they're comparable, there's comparable responsibility. If that's going to be carried out by interior designers, we just want to make sure that that same level of care that we give to life safety is carried out by others as well.
Do those, as I ask this, and I'll be quiet, folks, I'm trying to get educated myself here. When I go into my plumbing place at home and they help design and say, for $10,000 you can do this, and my wife writes them a check, and then I come home and tear stuff out, etc., and put new stuff in.
Right.
Does that plumbing store hold any liability on decisions I make in my house if I've got their picture?
The store, is that what you're asking? I do not believe
The
so. And
the
even
computer program people that wrote that computer program, is there liability with them? And I'm not being argumentative, but I'm just wondering because, you know, I have done work with a
Right.
chainsaw before, and
right. So,
change
but
walls.
I think we're speaking to locations where there probably is language related to municipalities. So
Okay.
even between like a Kansas City versus you know,
Amazonia.
St. Louis, or even some smaller towns.
Okay.
There are going to be local provisions for which version of the building code we accept, or which portions may be unique to us, or additional provisions. So it's our due diligence for every location to know what are the codes of that location, what are the requirements, who is required to seal. In cases of homeowners, you can make repairs on your own and you don't need to get someone to create drawings for you. So, but it's our job to have that discernment to know in which location, what is it that we need to provide. Yes.
Any other questions for this witness? Senator Brown.
So I asked the last witness about structural integrity, and I used the example of moving walls, to which she pointed out that they have training as far as which walls would be load-bearing versus non-load-bearing. Are there any specific examples of something that they might not be qualified for, which could jeopardize the life safety?
Well, I know we've had this conversation internally within our board specific to structure. Sometimes it's not just about the walls. Sometimes that's kind of like maybe the obvious thing to pick out in terms of a load-bearing wall, but sometimes even in terms of, depending on the type of space it is, we might have pieces of equipment or pieces of furniture or something added to the space, and depending on how the floor is constructed and the amount of load it can carry, we might be undermining the integrity of that space. So we have to have a really clear understanding, especially in existing buildings when we go into that space. It's not just the walls, but you need to understand all of our parts and pieces and what work they have to be doing, and making sure that we're not undermining those pieces.
Okay.
Thank you. Any other questions for this witness? Seeing none. Thank you, ma'am.
Thank you.
In opposition to, next witness, please. As we go along, and we have lots of people who would like to testify, please keep your comments succinct. I think we're doing pretty good, but we're also watching the clock. Thank you.
I'm recognized for being succinct all the time, so I'll do my best. My name is Chris Ball. I'm an architect from Springfield, Missouri. I'm here representing AIM Missouri and the 5,400 licensed architects in the state of Missouri. I'm here specifically to address examination requirements and also oversight. With regard to examination requirements, the testing for the NCIDQ exam has been updated as recently as February 1st. So they've gone a long ways towards making the exam more complicated and to better address some of these concerns, and we applaud that. However, it has not been in effect for any period of time for us to know how successful it is. And even though they've made it substantially more difficult and longer, it's still roughly half the size of the architecture exam and doesn't truly address the specificity that we get into on the architecture exam for these similar related professions. Architects are specifically educated and then trained in an office and then tested over the other disciplines besides ours that reside within our profession group. So we're trained in structural engineering and mechanical electrical engineering to a point that we can recognize complexities and concerns that might arise that might cause a conflict. I do not feel that the current interior design education reflects that, and the testing does not reflect it as well. In addition, with regard to oversight, a lot of concern resides in the fact that they would be regulated by the Interior Design Council and not Chapter 327, the Board of Architects, Engineers, Land Surveyors, and Landscape Architects. I can tell you, as a former member of the Architecture Division of the Licensing Board, a good portion of our time is spent addressing concerns as they relate to alternate professions and people who aren't trained and qualified to work on a part of a project because that's not where their education or their testing comes from. I see it a nightmare potential in terms of them sealing drawings and submitting those for permit, and then there not being a body in place that would be able to address those concerns and overlap. So if this was going to happen, I feel strongly it should happen within Chapter 327 in the board, but I'm opposed to it regardless.
All right, thank you. Senator
I
Black.
can answer any questions, even some of those ones you asked last time, if I can help.
Senator Black.
You said something very end, and my hearing aids were down, or I wasn't paying attention. Who's stealing what?
Excuse me?
I thought maybe I didn't hear you. I thought you said somebody's going to steal something and do it. No?
Seal drawings, not steal. No stealing.
Oh.
Interior designers and architects are in complete agreement on that.
They were not going to
No
steal.
stealing.
No stealing.
Absolutely not.
Thank you. Any further questions for this witness? Seeing none?
Thank you.
Thank you. Next, anybody who would like to testify in opposition to, please come forward. Good morning.
Good morning. My name is Nina Hinkins. I'm a senior plan reviewer for the City of Columbia. I'm also a licensed architect and a member of AIA Missouri. I'm here to speak in opposition of Senate Bill 1325. Excuse me. So as a plan reviewer, I review commercial construction projects, whether it's a new building or an addition, infill, or an alteration of an existing space for code compliance and building permit issuance. I believe that most city and county plan reviewers or plans examiners are not architects or engineers, so I believe I come with a unique perspective. In the 9 years that I've been a plan reviewer, the other building plan reviewers have been a building inspector, an electrician, and a contractor. So plan reviewers are charged with enforcing the International Building Code suite of codes, and I think most plan reviewers will have difficulty understanding the differences between architects and interior designers as this legislation is written. The code includes the building code, the existing building code, mechanical code, plumbing code, fuel gas code, the energy conservation code, fire code, national electric code, and accessibility standards, along with any of the reference standards that are listed in those codes. So these codes work together and can affect any construction or alteration project while having no effect on load-bearing walls or structural bracing, meaning lateral loads or shear walls. So on any given project, the structure of the building may not be affected. However, many times fire separation, separation continuity, or means of egress components are affected. These types of items are specifically excluded in this, excuse me, in the scope of the interior designers in the bill. There is no clear delineation of the scope of practice written in the legislation. There is no limitation on size of project, complexity, number of stories, or cost. Almost every commercial project I see are signed and sealed by architects and engineers. However, there are exceptions allowed by code where plans aren't required to be signed and sealed. There are even exceptions when building permits aren't required. For example, per section 105 of the International Building Code, the exceptions to building permits include interior finish items such as painting, papering, tiling, carpeting, cabinets, countertops, and similar finished work, and non-fixed and movable fixtures, cases, racks, counters, and partitions not over 5'9" in height. Also in the IBC, the International Building Code, section 107, the building official is authorized to waive the submission of construction documents and other data
not required to be prepared by a registered design professional. If it is found that the nature of the work applied for is such that review of construction documents is not necessary to obtain compliance with this code. And we have done that before. We've waived the requirements in the city of Columbia a few times. So final, there is a lack of oversight. Under this legislation, as it is drafted, the local municipality would be the entity to examine if the scope of work is written within the interior designer's scope versus what an architect would traditionally design. The city would not want to assume this responsibility and take the risk. The distinction between architects, civil engineers, structural engineers, mechanical, plumbing, electrical engineers is very clear. If the interior designers are signing and sealing drawings, the entity in responsible charge becomes very blurry for all. Thank you for your time. I'll take any questions.
Thank you. Are there any questions for this witness? Seeing none. Thank you for your testimony. We have next witness in opposition to. So we have had lots of great information, and please do not repeat information that was already been shared. Thank you.
My name is Susan Pruchnicki. I'm an architect in St. Louis. I'm an owner of a small business that's women-owned business, and one of my business partners is an interior designer. I'm here to talk to you about education requirements, continuing education, and the kickback disclosure. In architecture degrees, we have, because as the other testimonies have said, a lot more complexity in the different areas, because under life safety, there are items that come up other than structural walls. So as part of that, we learn about mechanical, electrical, plumbing, and structures as well. So our requirements for education are 158 hours over the 60 hours for the interior design. And continuing education, because there's so many changes in our industry that happen so quickly, we have a much higher requirement for continuing education for very specific health, safety, and welfare requirements that we are required to meet. And also, as part of our Architecture Practice Act, we are required to disclose as a professional design firm if our firm benefits by specifying specific items. So in the interior design industry and within this bill, it is not clear if an interior designer specifies a particular item if they are benefiting financially. So the bill would need to be clarified on that specific area to make it understood on the client's behalf. Take any questions you may have.
Thank you, ma'am. Any questions here? Seeing none. Thank you for your testimony. And next witness in opposition to. Just to get a count, how many more people would like to testify in opposition to? Okay, thank you. Proceed when ready.
Good morning. I'm Ryan King. I'm with AIA Missouri, testifying in opposition. I'm an architect, and I work for a firm that does employ interior designers, and they are our partners at our firm. I wanted to expand upon the idea of the code analysis and some of the ideas that non-structural walls being moved around. As part of our work as an architect and our training, we're uniquely qualified to understand how that design may affect the building as a whole or other elements as a whole that may affect health, safety, and welfare. Some of those examples are supports for things that are interior items but may not be part of the building structure, such as heavy equipment, heavy partitions that move. Other unique instances are sound ratings to walls, humidity and environmental requirements inside buildings that require unique temperatures and those requirements, such as in hospitals and pharmacies. So to blanket statement that some projects and interiors are simple and some are very complex. And this bill, as it's written, allows all of those projects to come under the purview of an interior designer. I would like to address the senator who asked about the kitchen and bath. In a residence that currently, under the architectural license, is excluded, it's not needed to be stamped, signed, and sealed for a residence, which means any single-family home or two-family residence type of structure. Also, in the state of Missouri, anything over 2,000 square feet that is for commercial use requires the stamp of an architect.
It's self-policed. If somebody does the work and doesn't get an architect, that is a problem. That can become a problem. But again, that it has to be self-policed. There's no architect police out there walking around looking, with their tape measures trying to measure and make sure the building's under 2,000 square feet or not. So.
Are there any questions for this witness? Senator Crawford.
Okay, just to clarify, do you or do you not think the interior design person is qualified to tell what's a load-bearing wall and what is not a load-bearing wall? You kind of referred a little bit to that, and maybe just can you speak to that a little bit?
I can speak to it from experience. I can't speak to it from I have not gone through their education or taken their test.
Okay.
However, I would say from my experience, I would say that is a no.
That's a
I
no?
don't believe they can determine that.
Okay, thank you.
Thank you. Any other further questions for this witness? Senator Brown. Oh, sorry, Senator Beck.
I'm Senator Beck today, thank you. I know I haven't said much, but that's fine. I do have one question for you, and this kind of goes into a bigger issue. So there's going to be a push here, and it's starting this year, to have statewide building codes. Yeah, well, I'm just telling you what's coming. So I didn't say I was in favor of it, but it's coming down the pike. And I was just curious, how do you envision this all folding in? I know we have these, I don't want to call them little, but territorial fights. I've been involved with this with mechanical contracting. As when you brought that up, you started giving me PTSD earlier. But I wanted you to expand on, I think at the end of the day, there's some path here, right? We found a path on that was like it was hard to find, but we found it. And I want you to expand on what you see, because I know this is an issue, and I don't see this getting solved this year. I'm just being honest. But I do see a bigger picture where we have some sort of statewide panel put together with all the particular people that are involved, so stakeholders.
So one of our other folks, the one that architects that had all the jokes, Chris, he mentioned that 327 exists, and that is the Professional Registration Board for professional, I'll call it designers. That's the surveyors, the landscape architects, and engineers. Currently, this legislation, as written, has its own board and its own policing. That offers its own problems with liability and policing of who is doing the right work within their purview. As far as statewide building codes, yes, there is that legislation that has been filed in the House. However, it still allows local control. So Nina, who did testify here as a code official, they could, in their own local determination, decide that if they would allow that to be an interior design purview, that scope is accomplished. It would have to be on a base by base thing, especially adopting IBC. I want to also make it clear that IBC is not the only building code. DHSS through the state is also using several other codes to modify hospitals. So that's FGI, that's NFPAs. There's a lot of other building codes out there, not just the IBC, that fall under some of these more complex projects.
I appreciate that answer. Thank you.
Thank you.
Any further questions? Seeing none. Thank you for your testimony. And so we'll have, I believe it'll be our last witness we have two more? Okay, we got two more. Come on now.
I'm going to be very brief.
Good morning.
I'm Mark Rhodes.
Hi.
I'm representing the American Council of Engineering Companies and the Missouri Society of Professional Engineers. Our concerns with the bill, and you've had some discussion about it, are the structural versus non-structural elements that are contained in the bill. I think it goes, Senator Crawford, I think it goes beyond what is load-bearing and what is not load-bearing. I think you have other construction elements that need to be considered that go beyond the load-bearing walls and that might require additional architecture or engineering services. It's very unclear to us, and I think it's a blurred line. And with that, I'll answer any questions.
Thank you. Are there any questions for this witness? Seeing none. Thank you, sir. And now we have our last witness, but not least. Good morning.
I don't know about that, but
Sean Tubman, or good afternoon, or good morning. It's afternoon for me. I got up early to be here this early, so good morning, Chairman and committee. Sean Tubino with Bernskoetter Enterprises. We're a 91-year strong company in Southwest Missouri, and I'm here representing AGC of Missouri, our 500 members across 110 counties. We are testifying in opposition to Senate Bill 1325. As a contractor and over 35 years in the industry, I've seen a lot of things. We also do design build work where we're in charge of hiring the design team. I know when I need to call an architect. I know when I need to call an interior designer. I know when I need to call a structural engineer, a mechanical engineer, all that. Our concern is, first of all, it's been said to follow other states. Other states have all kinds of bad ideas. We're in Missouri. We don't follow anybody. We lead. This needs to be fully vetted with the code officials. We heard from one. That was one of my concerns. They've kind of narrowed down my comments here, so they've kind of taken them all. I'm trying not to take your time, but the education requirements, and I've worked with interior designers and architects for years. They're not the same. They don't have the same knowledge. They just don't. While they have knowledge specific to their industry, they don't have all the knowledge that an architect has with the entire building. And other than that, everybody else covered everything else. So,
Thank you. Do we have any questions for this witness? Senator Crawford.
Good morning,
Sure.
Sean. Just a quick question. So in your opinion, what's the biggest difference between the two categories? I mean, I feel like you're kind of in the middle of the groups, and you've had experience with both. So what do you feel is the biggest maybe detriment or strengths or weaknesses for I just kind of want your opinion on that specifically.
right. Well, interior designers they're very knowledgeable in space function and appearance and things like that, movement of traffic and things. I mean, they know where not to put a piece of furniture, where not to put a cabinet, but they also, I have found in the past, that they don't necessarily know where putting a huge cabinet could cause an issue on the floor below, that kind of stuff. And it was said at one point that this would reduce cost. I don't see that. They're still going to charge. An architect charges a fee. They're going to charge a fee. If it gets beyond their scope in here, they're going to have to hire the same kind of people that an architect has to hire. Or it actually could increase the cost. I thought about that on the drive up here, because if they got into a job where they had to move a structural wall or get with an architect who knows more about the entire building process, then they'd have to hire an architect on top of their fee. So it actually increased the cost on some projects. And the oversight's a huge deal. I mean, that would be a huge deal for the contractors.
Thank you. Any other questions for this witness? Seeing none. Thank you, sir. Okay, so is there anybody else who would like to testify in opposition to? Seeing none. Anyone for informational purposes only? Good morning, Lynn.
Good morning, Madam Chair, members of the committee. Lynn Schlosser here today on behalf of the Missouri Society of Professional Land Surveyors. We are neutral on the bill, and I have sent our one small concern to the sponsor on page 8, where it talks about if engineering services or land surveyor services are required, that the interior designer may compile the documents, and we just wanted to add upon authorization from the surveyor or the engineer that perform the service. That's all I have.
Thank you. Any questions for this witness? Seeing none. Thank you. Any additional information, testimony for informational purposes only? Seeing none. So that concludes the hearing. Do you have any closing remarks?
I just wanted to say thanks to everybody who was here. Thank you for hearing the bill. I believe in the legislation there's clear differences laid out between interior designers and architects, and I think it can be emphasized once again that interior designers do not want to be architects or engineers. And also, what wasn't mentioned earlier is that this language has been vetted and worked out at the national level, so there's been common ground found at the national level between all of these different groups. So, so they worked it out at the national level. Now I think what we're doing is bringing these concepts to the state, and we're going to work things out as well. So
all right.
I'll keep working. Thank you.
Thank you. So that concludes the hearing on Senate Bill 1325. And so now, I know there's going to be several people leaving the room. We will now hear Senate Bill 956, and I will be turning the gavel over to Senator Crawford, as I will be presenting Senate Bill 956. Here. There's that. Pardon me.
We'll now begin the hearing on Senate Bill 956 with Senator Eslinger. And Senator, when you are ready, you may proceed.
Okay, good morning. Good morning, Chairman Crawford. For the record, Senator Carla Eslinger, representing the 33rd Senatorial District. Thank you for the opportunity to present Senate Bill 956 that would allow licensed optometrists to use injectable agents and surgical procedures for certain purposes. Simply put, this bill would expand the scope of practice for licensed optometrists in Missouri. This legislation actually was brought to me when I had a constituent in West Plains, an optometrist, who brought my attention that even though they are licensed in Missouri and trained on the procedure outlined in this bill, they cannot practice these procedures in Missouri, but basically just drive 30 minutes south down to Arkansas, and they're able to do that. So I think it's important to note that nothing in this bill would expand the scope for optometrists outside of what they have been trained and educated on during their studies. In fact, our office have signed affidavits from several schools of optometry testifying to the educational level they trained their students in and has been the case for the last 30 years. I think it's also important to lay out what this bill will allow optometrists to do and what it would not allow optometrists to do. In front of you, and I know that we're going to make those available to the committee, in front of you, you should have a list of all the things that this bill would allow optometrists to do that they are currently not allowed under statute, and what it would allow them to do. Optometrists are not asking to expand their scope to practice outside their educational level, as they know it would open them up to malpractice suits and possible loss of licensure. In summary, 956 would bring Missouri into the modern world of allowing optometrists to practice to their educational level and allow for better patient access. I'd be happy to answer any questions, but I also know that we have several very talented and very informed witnesses on both sides of this legislation that would give more expertise than me. Thank you for their time.
I have no questions, so first up in favor of Senate Bill 956, please come forward at this time. Please remember to fill out a witness form and leave it on the table, and be sure to tell me who you are.
Good morning. Do you have your witness form?
Good morning. My name is Dr. Mark Curtis. I'm a practicing optometrist in Warrensburg, Missouri for the past 28 years. I'm here to show support for Senate Bill 956, the Optometry Modernization Bill. Since I'm going first, I'm going to kind of give you a basic kind of overlay of the bill and what this is. This bill would allow optometrists to perform in-office surgical procedures that we are already educated, trained, and certified to perform. These procedures include, number one, what's called a YAG capsulotomy, an in-office surgical procedure that's used to help clear someone's vision after cataract surgery. Number two, SLT, another in-office surgical procedure to help lower eye pressures for patients with glaucoma. And number three, in-office injections to help remove lumps and bumps around the eye, but not in the eye, just around the tissue around the eye. So, first of all, we got a lot of doctors behind us that, some are going to be testing for and some against. So what's the difference between an optometrist and an ophthalmologist? Well, after undergrad, an optometrist will then go to 4 years of optometry school, where we will be trained specifically on the diagnosis, treatment of eye diseases and conditions, including the in-office surgical procedures that I mentioned earlier. After undergrad, an ophthalmologist will then attend 4 years of medical school, followed by a residency to specialize in eye surgeries that are performed in an operating room.
As a reminder, in the list of the package I just gave you, there is a list of the operation room procedures that are not included in this bill. As you know, advancements in Medicare or in medical care has changed at a very whirlwind pace over the last 30 years. Yet our scope of practice for optometry has not kept up to date in those 30 years. The in-office laser procedures that are in this bill have already been performed well over 100,000 times by optometrists in the United States. The 12th state, South Dakota, the governor just signed the law to allow optometrists to do these procedures just last week. 3 of those 12 states border Missouri. The in-office injection procedures are already allowed in up to 41 of the states. As you can see, we are falling behind the rest of the country as far as our scope of practice. You're going to hear testimony from several doctors, like I said. Many are for it, some are against it, but in your packet, I think it's worthy of noting that not all ophthalmologists are opposed to this bill. A very well-respected ophthalmologist in Springfield, Dr. Dan Osborne, supports this bill. That is in your packet, that letter from him. Our opposition may also say that this bill and law is not necessary because appointments with the specialist and ophthalmologist are already available. I live in Warrensburg, Missouri. I can assure you that that is not true. In your packet also, I have 2 letters from patients that I saw myself, both of which I referred for the YAG capsulotomy to get their cataract surgery improved with the laser. Both of them, I saw them in January. One of them just had a procedure this past week. One of them is still waiting. Now, I'm sure that there are pockets in Missouri where there are appointments ready available, and I know if I called an ophthalmologist and said I had an emergency visit, such as a retinal hole or tear or detachment or some sort of eye emergency, they would get them in right away. But for procedures such as this, on average, it can be 6 to 8 weeks to get in some of these procedures. So if you think about those 2 patients that I saw in January, both of them have blurry vision. Both of them are having to not be able to drive comfortably, not be able to see the things they like to do well, such as reading, going to the movies. We're asking them to wait 2 months to have a procedure done that I could have done there that day. They may also say that there are surgeons and ophthalmologists within 30 miles. So again, we're asking patients, oftentimes Medicare-age patients, to drive into the city from a rural area. That is just not necessary when we were already able to do these procedures. Another argument that you may hear is that optometrists are not qualified to do these procedures and that all we want to do is a 32-hour weekend class. That is not true. Optometry school is 10,000 hours of dedicated training towards eye care. These procedures are already included in the curriculum of every optometry school in the country, including our own University of Missouri. I would think that if the University of Missouri thought it was okay for optometrists to be trained, that it should be okay to do so. For those of us who are more seasoned, who graduated before these procedures were part of the curriculum, yes, it is a 32-hour class. But remember, for each year I've been in practice, those 28 years, I have probably 2,000 to 3,000 hours worth of experience already taking care of the pre and the post-op care for these patients. We're already the ones who are dealing with the complications that can arise. The only thing we are not able to do is to actually do the procedure itself. One of the doctors you'll be hearing from here is an optometrist, well, the optometrist that Senator Eslinger talked about. She can literally drive 30 miles away and she suddenly becomes qualified to do that procedure. But as soon as she drives back into Missouri, she is not allowed to do so. I'll be glad to answer any questions that you have. If not, I'll turn it over to the next person.
Just real quickly, the expansion of the scope that we're looking at here, how much training do you feel like you've had, specific training in the areas that we're wanting to expand? Like not just general optometry, but in the specific areas. Can you just talk about that a little bit?
I'll talk about the YAG capsulotomy, those 2 patients. I will typically see 20 to 25 patients a day. I would so figure about 100 a week. Of those 100, I'm probably seeing 10 patients a week that I'm looking at specifically for these, and then every week I'm referring patients and coming back. So I'm already dealing with
the complications of these things sometimes 2 and 3 times a day. I hope that answered your question.
Really, I was asking more about the education piece of it, like how much training in education have you had in the areas that we're trying to expand?
Okay. Well, for me, it was that 32-hour class.
Okay.
But for optometry students in the last 10 plus years, it's all part of that 10,000 hours worth of training. One of the next people that's going to testify is one of the professors that does the teaching at the University of Missouri. She can answer exactly more details.
Okay, thank you. Senator Trent, we're on Senate Bill 956. Do you have any questions for this witness? Okay, thank you for your testimony.
Thank you very much.
Next up in favor of Senate Bill 956, just to get an idea, how many are here to testify in favor of? Okay, how many in opposition? Okay, all right, we're pretty good then. Okay.
Morning, members of the committee. My name is Jeff Gamble. I'm an optometrist in Columbia, Missouri, owner of a multidisciplinary practice there. I've been practicing for 20 years, over 20 years. And for most of those 20 years, because of my proximity to the Capitol, I've also been coming down here and having these discussions very similar that we're having today. And over those 20 years of the discussions I've had before this body, they've kind of taken on a pattern where obviously our opposition is trying to consistently make attempts to limit this profession as well. The mantra is typically that we are not trained well enough, and that's persisted through those 20 years as well. I think you'll find that mantra is a little bit wide. The Senate Bill 956 looks a little bit different than what you might expect in the language. I've met with the leadership of the opposition multiple times, actually, about 4 times last year, trying to draw out some compromise in defining the language of where does the line exist. That, from my perspective over the conflict we've had for many years, that seems to be part of the struggle is where do we draw a line? And so I actually like the language very well because I think it attempts to do that. If we can put into the language what we're not allowed to do, it better distinguishes the difference between optometry and ophthalmology. Unfortunately, this opposition, in their unwillingness to compromise, has suggested that if we open the door to this language, we will compromise patient safety, produce unregulated providers, and threaten the integrity of our healthcare delivery system. I would suggest that in the last 20 years, they've been wrong about our attempts in our expansion of our scope, and they're wrong again today. Despite what our opposition suggests, I think this bill is in a legitimate need. And actually, this legislative body has put in place a regulatory board to monitor the advancements of our profession. I would say that's probably better than constant revisions of our law, adding specific nitpick language to expand as opposed to defining a boundary that suggests what's the difference in our practices. Senate Bill 956 clearly defines what procedures we are not allowed to do. I think that's been brought to your attention that in the packet that's included. These procedures are outside the definition of optometric care, the ones that we are not allowed to do, and safely within the realm of ophthalmology. We concede that. It's my hope that this approach actually redefines the endless narrative of conflict between the two professions into a more reasonable discourse. I find that when we get along and our boundaries are clear, then our patients actually do better. The procedures the language permits are highly specific and well within the boundaries of optometric training and education. That's been brought up. Innovations in education, training, and technology should expand the opportunity for Missouri residents to receive quality care in an efficient, safe, and judicious manner. I would suggest that the language as it's put can actually limit the infighting that exists between our practice and provide better care for our patients, and I believe they deserve that. Thank you for your time and attention. I'm available for any questions.
Questions for this witness? Seeing none, thank you for your testimony. And be sure and leave a witness form if you have not yet. Next up in favor of Senate Bill 956.
Good morning. My name is Dr. Angel Novel Simmons, and I've been practicing optometry in Missouri for the past 20 years. I graduated from UMSL's College of Optometry in 2003, and UMSL's been educating optometrists in the state for over 40 years. Not only do I attend to the patient care needs of Missourians, but I also educate optometric students at the school.
I am an assistant clinical professor, and I'm also the director of our fourth-year clinical program and our continuing education program. There are 24 schools of optometry in the United States, 2 in Canada and 1 in Puerto Rico. Each year, optometric programs graduate nearly 1,700 graduates, independent practitioners. All schools are accredited by an accrediting body that evaluates and adjusts curricular needs and demands as the needs for our patients continue to evolve. In short, there's uniformity across education across the entire nation. If you attend one school or college of optometry, then you can be licensed in any state. Missouri is fortunate that we have a college here. We're the only one in the state of Missouri. We are accredited by an ACOE, it's our accrediting body, and we graduate about 45 students per year. We educate, certify, and train our students to the highest scope of practice. So if you are in Missouri, you're gonna learn all the skills that you would need, just like if you were educated in Kentucky. Our first year curriculum begins with a deep dive into anatomy and physiology. They have to understand optics, neurology, optometric care, because basically the eyes are connected to your body. So if you don't understand the body itself, then you can't understand eye care and navigate eye care. And this all begins kind of day one in our curriculum. As the complexities improve in our curriculum as we get into further years of education. So our second year students are learning even more, third year students even more, and our fourth year program is strictly clinical. They will see probably over 1,000 patients during that 4-year period, or during that fourth year curriculum. They see patients in a wide variety of modalities as a fourth year, so not only in pediatric care, but co-management styles, co-management surgical centers. Our students work in tandem with ophthalmologists and ophthalmology residents in order to have like a symbiotic relationship. A lot of our students are in co-management practices with ophthalmology, so they're able to kind of practice to the scope that they need to, and they're able to manage all the complexities on the preoperative side and the postoperative side with regard to their educational training. To be a licensed optometrist in any state, including Missouri, we have to graduate from our programs. We have to pass 3 sets of national boards. Those all are required. And then you have to comply with your state board's regulations for what your level of scope. Optometry is one of the few professions that ensures competency prior to graduation, allowing optometrists to practice independently once they've been licensed. I appreciate your time today. If you have any questions, I'm happy to answer.
Questions for this witness? Seeing none, thank you for
Thank you
your
so much.
testimony. Next up in favor.
Good morning. My name is Nicholas Whitesides. I am the president of the Missouri Optometry Student Association and the student liaison to the Missouri Optometry Association. I'm currently at the University of Missouri St. Louis College of Optometry, where I represent 169 students. Being a student who is both searching for employment as I near the end of my 4-year academic career and preparing to take my big boards exam next week, the passing of this bill is crucial to my decision-making on where I decide to practice post-school. And many of my fellow students feel the same as I do. I recently took a poll of the student body, and of the 119 students that responded, the 55 Missouri residents, 76% of them said that they would consider leaving the state and finding work outside if this bill were not to pass. Conversely, the 64 non-Missouri residents said that they would consider staying in the state of Missouri to practice if this bill were to pass. As you can tell from these statistics, the passing of this bill is crucial in all of our decision-making processes. Everyone wants to be respected, and optometrists and optometry students are no different. This bill is critical in not only attracting but keeping young doctors in the state. Overall, SB956 must be passed. It secures the next generation of eye doctors for the state, but not only that, improves access to care for those patients who are otherwise unable to obtain it.
Thank you for your time and consideration. I look forward to any questions you may have.
Questions for this witness? Seeing none, thank you for being here today. Next up, in favor of Senate Bill 956.
Hi, I'm Dr. Julie Hart. I'm out of West Plains, Missouri. I am the optometrist that can practice both in Arkansas and Missouri. I did get my Arkansas license after they passed their scope expansion bill, so I can perform these procedures on my patients. We have patients every day that need a YAG or an SLT, and they ask me, hey, can we just go across the border to Arkansas, drive 30 miles down the road and get these procedures done? And they're willing to drive down there so I can perform these procedures. If they were to wait for the ophthalmologist in town to do it, it would be a 3 to 4 week wait for the patient to get that procedure done. And as they said earlier, in some of the areas of the state, it's 6 to 8 weeks or longer before they can get those procedures done. Part of my training, I trained right along, the ophthalmology residents when I was in Miami and when I was also in the St. Louis VA. So I feel we should support this bill.
Questions for this witness? Seeing none, thank you for being here today. Next up, in favor.
Good morning. Members of the committee, my name is Tom Green. I'm a practicing optometrist here in Jefferson City. Been practicing for close to 40 years. I'd like to address some of the printed statements that opponents of this bill have put forth over the last few weeks. The Missouri State Medical Association put out an opposition briefing that begins by stating the differences in our education and concludes with the statement that these complex medical or complex surgeries of the eyes without parity in education is wrong for Missouri. What my colleagues in opposition to this bill will try to convince you of is that their education is the only education that can perform these procedures safely and effectively, and that's simply not the case. These procedures have been taught, as you heard, in every optometric college throughout the U.S. for decades, and optometrists have performed over 100,000 of these procedures nationwide effectively and safely for decades in other states. They are complex procedures with complex decisions that we are educated, trained, and certified to perform. The briefing also goes on to state, and I quote, another argument made by optometrists for their proposed ability to perform eye surgeries is that it is necessary to alleviate rural healthcare access crisis. Then it states that optometrists predominantly don't live in rural areas and won't move to rural areas if their scope is expanded. While we mostly live where our patients live, there is an optometrist living and practicing in 75% of the 114 counties in the state of Missouri. Ophthalmologists practice in only 30% of the 114 counties in Missouri. We won't have to move to rural areas. We already live there. There's also a briefing put forth by the Missouri Society of Eye Physicians and Surgeons entitled Drive Time to Ophthalmology Point of Service, and that briefing states that 81% of the population is within a half hour to an ophthalmology point of service, but I believe that this is misleading. 65% of Missouri's 6.2 million citizens live in the 14 counties that surround Metro Kansas City, St. Louis, Springfield, and Columbia, and the large majority of ophthalmologists live and practice in just those 14 counties. Senator Crawford, thank you for your time and your service on behalf of the citizens of Missouri, and if you have any questions, I'll be glad to answer.
Questions for this witness? Senator Trent.
Thank you. Yeah, I've got a real quick question, if you would. You mentioned that optometrists have been performing some of these procedures across the country for some time now.
Yes.
Do you have any data on comparing these procedures when they're performed by optometrists versus ophthalmologists, like error rate, success rate, that sort of thing?
I don't personally have any. I can certainly talk to the people, the rest of optometrists, and I can certainly get you that information.
Yeah, it seems like that would be convincing data if these procedures can be performed by optometrists with the same level of efficacy as ophthalmologists, I would think, and this has been going on nationwide for some time. I would think that'd be very compelling data. So.
Very good, Senator. Like I said, I'll search for that, and I'll try to get it for you later on today.
All right, thank you.
Further questions? Seeing none, thank you for your testimony. Next up, in favor of Senate Bill 956. And just real quickly, is this the last in favor? Is there anyone else? Okay.
I brought more up here with me than I needed. Good morning, Senator Crawford, committee members. Thank you so much for allowing me to testify today. I'm Dr. Kelly Deering, and I'm a small-town optometrist in Chillicothe, Missouri, in full support of Senate Bill 956. I am Missouri-born, raised, and educated. Umsel College of Optometry thoroughly prepared me to take the utmost care of my patients, and out of several job opportunities around the nation, God brought me to Chillicothe. I adore my town and I love my patients. Firstly, I respectfully want to point out that nearly all of the ophthalmologists that have been walking around the Capitol practice in larger metropolitan areas. They claim that there's no shortage of ophthalmologists, but they don't travel to my small town. They don't travel to small town Missouri. Plus, the maps that we've provided speak for themselves. From 2020 to 2035, total ophthalmology supply is projected to decrease 12%, while demand for surgery will increase by 24%. By 2035, ophthalmology is projected to have the second worst rate of workforce inadequacy, 70% of 38 medical and surgical specialties studied. I have that study if you need it. And ultimately, our patients need us now, and they're going to need us more very soon. Even though I have an incredible relationship with the ophthalmologists who visit Chillicothe once a month, my patients' wait times are long and they're often insufferable for them. The current wait time for a YAG is 2.5 months. If a patient's willing to drive 90 minutes away, they may be able to have it done in 3 weeks depending on the time of year, but the patients who desperately need this procedure are elderly. They have a film so dense that they're not legal to drive in the state of Missouri based on that vision reduction, and they either don't have family to take them or they don't want to inconvenience their family, so they choose to wait. In my opinion, they shouldn't have to wait longer than a week with debilitating vision when I have the certification to perform this procedure myself. For patients who choose SLT for glaucoma or for patients who need a lid lump biopsy, they have no choice but to travel that 90 minutes because my dermatologist won't even touch the eyelids. I should be able to perform that SLT within the week and biopsy that lesion today. If I had $10 for every patient who's asked me, well, can you do that procedure for me, Dr. Deering? I may have my student loans paid off by now, honestly. I see my patients every year, you guys more frequently if they have eye disease. I see their spouse, their children, their grandchildren, their great-grandchildren. They know me around town, and they trust me, and they want me to do their procedures that I'm trained to do. You'll probably hear from ophthalmologists today about how much longer they spent in school, how many hours, inpatient care they received there, how many more they may have had than we do. And there's no argument from me. My ophthalmologists need more hours because they perform critical in the eye intraocular surgery that requires an operating room and comes with serious complication risks, surgery that no optometrist wants to do. SB 956 allows optometrists to perform the 3 categories of in-office procedures we are well trained for: lid injections, lump and bump removal, and in-office laser procedures for YAG, SLT, and LPI. 100% of optometry surgeries fall within these 3 categories. Yet these 3 categories only make up 8.5% of the procedures that ophthalmologists perform. Missouri's last scope update occurred when I was 1 year old. Under it, I can't even give an EpiPen to save a life, but I remove metal from corneas multiple times a week, especially this time of year, unfortunately. Our current statute is archaic and needs updated because limiting optometrists and other rural healthcare providers hurts our patients. This bill's exclusionary language has been passed in at least 4 other Missouri and southern states, Midwest and southern states, not Missouri yet. And it'll allow the Missouri Board of Optometry to better govern our profession. Of the 146,000 laser procedures performed by optometrists over the last 20 years in the states that authorize, optometrists to do so, including Arkansas, Oklahoma, Kentucky, Mississippi, among others, we're surrounded. There have only been 2 complaints to their state boards. 2. This means you're 6 times more likely to be struck by lightning than to have a bad outcome from an optometrist performing a laser procedure. I would allow any of my classmates to perform these procedures on me because our education was just outstanding. I'm so proud of my Missouri schools, and I really want to be proud of my Missouri legislature for passing this bill so that I'm allowed to take better care of people the way they deserve. Thank you, and I'll address any questions.
Seeing no questions for the witness, thank you for being here today.
Oh, can I address some previous questions you guys had?
You may.
Okay. Sorry. Probably should have done that first. So, Senator Crawford, you'd asked how much education and training we've had, and I can speak for myself. I graduated in 2020, which was supposed to be an exciting time to graduate as an eye doctor, and obviously, things were tough that year. But I performed these procedures in school. I have 10,000 hours just through that education alone. Plus, I've been through the 32-hour course because I haven't been allowed to touch a laser for 4 years, And man, was that awesome, And it just reminds me of the better care that I can give patients. Senator Trent, you asked for data on complication rates, and there's actually great data. I have a study here, but it's specific to YAG capsulotomy performed by optometrists versus ophthalmologists, and the rates of complications like pressure spike, inflammation, pits, retinal tears, similar, or actually better in this study, to be honest with you, between optometrists versus ophthalmologists. Ultimately, we take care of the complications from these procedures already. We know how to run a slit lamp. We've been trained. There's really no reason why we shouldn't be allowed to do this.
Thank you for that. Just one more time, anyone else in favor of? Seeing none. Next up in opposition to Senate Bill 956. And our time is kind of ticking away, so if you can maybe keep your comments somewhat brief.
Thank you. First, I'd like to thank the committee and Chairwoman for allowing me to speak in the opposition of the request by optometry to expand its scope of practice. My name is Denise Hugg. I have a very unique perspective to speak on the subject of optometric scope of practice, as I am both an optometrist and a pediatric ophthalmologist. I'm speaking on behalf of MOSEPs today. I'm going to quickly tell you my story. So I grew up in a very small rural town where the only doctor was an older family practice doctor, nobody's favorite. An optometrist would come from the city once a month, and I started wearing glasses when I was 12 years old, and I thought that optometrist had a great job. At this time, I didn't even know ophthalmologists existed, so I decided I wanted to be an optometrist. I went to college, got my undergraduate degree, did 4 years of optometry school. After graduating, I practiced for 3 years. It quickly became clear to me that there was so much I didn't know. I didn't truly understand both the simple and sometimes very complex systemic diseases that my patient had. I actually thought I knew a lot about pharmacology as we had studied it in optometry school. I realized I did not even close. These were issues that bothered me, so I decided to do something about it and went to medical school. There's no comparison in the intensity and the scope of learning between optometry and medical school. I knew I had a gap in my knowledge prior to medical school, but as the old saying goes, I didn't really know what I didn't know until I went into medical school. After 4 years of medical school, 1 year of general internship is required. This is an invaluable experience. It is where you really start to learn how to care for patients, not just treat diagnoses, but to really care for people. 3 years of residency follow in ophthalmology, where thousands and thousands of hours are spent learning and applying medical knowledge and surgical skills. I personally did an extra additional year of training in pediatric ophthalmology
that year alone, I performed over 300 individually supervised eye muscle surgeries, just eye muscle surgeries. There's simply no equivalent education in the optometric world. I think it's also important to understand that each of these steps, medical school, internship, residency, fellowship, are all stepping stones. They build on the previous step. It would be madness to skip medical school and just start residency. The main reason I oppose the bill is the potential public health risk.
Excuse me just a second. They're having trouble hearing you. Can you
Oh.
pull the mic closer?
Yeah,
Thank
sorry.
you.
Okay, I'm sorry. I kind of have a soft voice, and my mouth's really dry. Sorry. Okay, the main reason that I oppose this bill is the potential public health risk. It requires thousands of hours of training outside of just the eyeball to be able to provide the care that is being asked for by optometry. There's absolutely a role for optometry in eye care, but it's not to manage medically complex diseases or to perform eye surgery in any form. Finally, please understand, I am not anti-optometry. My brother, my sister-in-law are both optometrists. Oh gosh, thank you so much. Our practice has 6 optometrists, so I'm really quite fond of optometry. I would also like to add that not all optometrists want to expand their scope of practice. For example, my brother and sister-in-law have no desire to practice medicine. Because of where they are employed, they see the vast difference between ophthalmology and optometry and realize that each profession has a role in the patient's lives. For optometrists who do express an interest in increasing their scope of practice, I always encourage them to do it, but to do it the proper way, through education and not legislation. I'd be happy to answer any questions. I worked at Children's Mercy. I was involved in educating residents and fellows. I've been on the American Board of Ophthalmology examiners, so I have a wide berth of knowledge.
Questions for the witness. Senator Trent.
Yeah, I'm sorry, I couldn't quite hear you there. Where did you say that you practice at, or where you taught at?
Children's Mercy Hospital in Kansas City.
Okay, so you're a Missouri doctor?
Mm-hmm.
All right. So is of the components of the increased scope of practice here, are you against all of them? Are there any of them that you think an optometrist could perform, or you think that all these should only be within the realm of ophthalmologists?
So we'll start with lasers. I think it's been, no, I can't say that. Lasers are often called a procedure. You just point and shoot. It's so much more complicated than that. And I think lasers should be in the hands of ophthalmologists. Removing eyelid lesions, I also believe, should be in the hand of ophthalmologists. The reason for that is, especially in the elderly population, that a large percentage of those are cancerous, and they have to be removed carefully to treat the problem appropriately. I noticed in the bill that they would like to be able to do probing of the lacrimal system, which is something I can speak to directly because that is a common procedure performed by a pediatric ophthalmologist in infants. And I will tell you, it is one of the harder procedures to teach residents because it's all about finesse and understanding the anatomy and being very careful when you do it so that you don't tear eyelids, you don't permanently scar that system. So,
well, let me ask my question this way. We've kind of heard from the other witnesses here, and folks have said that optometrists are performing these procedures in other states around the country. Is that accurate? Is that your understanding as well?
Which procedures they perform in what states?
But some of these are, like the capsulotomy was particularly identified earlier as one that is performed in other states. To your knowledge,
we had another witness that testified that the error rates seem to be comparable or maybe even favor the optometrist. Do you have any knowledge of comparable success rates when these kinds of practices are performed in other states?
My colleague can probably better answer.
Okay.
that.
Well, we'll save that question for the next witness then. Thank you.
Any other?
Thank you for your testimony. Next up, in opposition to Senate Bill 956.
Good morning, Madam Chairman, members of the committee. Thank you for allowing me to speak to you today. Thank you for working with us on this bill. My name is Jim Lutkemeyer. I'm an ophthalmologist here in Jefferson City. I'm here today on behalf of the Missouri State Medical Association in opposition to this bill. The bill here would allow optometrists to expand their scope of practice, obviously. And the way we read this bill, it would be a very broad expansion of the scope of practice, particularly as laser technology continues to improve into the future. The way we read this bill, for example, as laser technology improves in the realm of cataract surgery, it would be within the realm of optometric scope of practice for optometrists to perform laser cataract surgery. In the state of Oklahoma, a similar but less broadly expansive expansion of scope of practice was passed some years ago. Oklahoma is kind of held up by optometrists as a model to follow. In fact, they'll point to Oklahoma as a state that Missouri should follow. Well, in your packet, you have a letter from Dr. Ben Harvey. Dr. Harvey is an ophthalmologist at the University of Oklahoma, Dean McGee Eye Institute. He's a specialist in glaucoma and teaches ophthalmology residents at Dean McGee Eye Institute. In this letter, Dr. Harvey chronicles a number of patients who had adverse outcomes as a result of laser treatments performed by optometrists. I'd encourage you to read it. Look at all 5 of those patients. I'd like to just go over a couple of those. Patient number 3, for example, on page 2, is a patient who was identified by his optometrist as needing a laser iridotomy for the treatment of glaucoma. The patient consented to the procedure, and upon performing this procedure on the first eye, the optometrist encountered bleeding, was unable to complete the procedure, elected then to proceed to the other eye, where a similar procedure was attempted. Again, there was severe bleeding, and the procedure was finally aborted. Ultimately, this patient presented to an emergency room because of loss of vision and severe pain. An ophthalmologist assumed the care and took care of this patient. Ultimately, it was determined that this patient didn't even need the laser treatment that had been recommended. This patient was harmed by legislation such as this in Oklahoma. Patient number 4 is a patient who presented to an optometrist with cloudy vision, and a YAG laser capsulotomy was recommended. The optometrist performing this procedure had difficulty focusing on the lens capsule, which can happen. The optometrist decided to put a lens on the eye to better focus the laser. Unfortunately, he chose the wrong lens, and instead of focusing the laser on the lens capsule, the laser was focused on the retina, specifically in the macula, the center of the retina. Upon performing this procedure, this patient suffered permanent scarring, permanent loss of vision because of inadvertent damage to the macula. These patients suffered harm as a result of this of these attempts at laser treatment. These things happened in Oklahoma, that shining beacon on the hill that Missouri is said to need to emulate. These things happened in Oklahoma.
if this legislation passes here, it's likely that similar such occurrences will happen here in Missouri. To think that won't happen is wishful thinking. Wishful thinking is not a basis for sound public health policy. That's why we oppose this bill. I'd like to address a couple things that were brought up by you, Senator Trent, and some of the optometrists. In our practice, when patients are referred for laser treatment, like YAG laser capsulotomy, we get those patients in within 2 weeks. I can't speak for every ophthalmologic practice in Missouri, but that's how we do it. And I would encourage optometrists who can't get their patients seen by an ophthalmologist within a couple months to pick up your phone, text your ophthalmologist friend and say, hey, I couldn't get past your phone answering person to get this patient in for a treatment. Can you see them sooner? And I would bet the answer will be yes. I can't speak again for every ophthalmologist in Missouri, but that's our priority. And then, Senator Trent, you mentioned data. If you don't have it in your packet, there is a study that came out of Oklahoma a while back comparing the effectiveness of laser trabeculoplasty performed by ophthalmologists versus performed by optometrists. I don't have that study right in front of me, but I do know that that study shows that the retreatment rate was twice as high in the patients treated by optometrists compared to patients treated by ophthalmologists. In essence, in order to get the glaucoma under control, it was twice as likely to have those patients have to be treated twice when an optometrist performed the procedure. It all comes back to training too. With respect to the problem, these problem patients that came out of Oklahoma, it's a training issue. I know our optometry colleagues like to talk about the extensive training they have, but it's not good enough. These problems that are chronicled in this letter from Oklahoma, this should never happen. Statistics and data, it's all about numerators and denominators, and fortunately in our world, denominators are pretty large, but certain things should never happen. The cases I described to you, the numerator should be 0, and that's why we oppose this bill. I'd be happy to entertain any questions.
Questions for this witness. Senator Trent.
Yeah. Thank you for addressing some of those previous questions. I will look for that Oklahoma study. It's kind of the same question I had for the previous witness. Of the scope of expansion pieces that are in this bill, do you think any of them are appropriate, or do you believe that all of them are such that they're outside the training of the optometrists?
I think the way things stand now, there's a clear distinction. The lines haven't been blurred, so to speak. There's a clear distinction between what ophthalmologists do and what optometrists do. And moving that line, it's just not appropriate.
Well, I understand that, but do you think it's inappropriate because they're inadequately trained, or is there another reason?
Yes, I think training to do a laser treatment, for example, should be training performed on a living, breathing human being. The eyes of living, breathing human beings can suffer complications. There can be pain, there can be bleeding, there can be scarring. If those laser treatments are not being done on living, breathing human beings, the training is inadequate. In ophthalmology, we learn to do these procedures and a bevy of other procedures over the course of 3 to 4 years under the watchful supervision of an expert who's not only good at doing the procedures, but also good at teaching.
So you think that there's a kind of laboratory component? Well, maybe laboratory is the wrong word. I'm obviously not a doctor. A practicum, like where they're actually in the field doing the work, that is important to be able to accomplish this. And how much time? Because obviously, I would assume an ophthalmologist is doing a variety of things. You're not spending the full 3 or 4 years on any one of these procedures. Like, how many hours do you think, are necessary? I guess what I'm asking is, like, is there a compromise? Like could there be a
like an increase in the training requirement that would come in tandem with this scope of practice increase that you think would satisfy medical necessity?
The increase in training has to be on real people who have these problems, and these procedures are performed on living, breathing human beings under the supervision of an expert. Those patients don't just walk in every day. And so over the course of an ophthalmology residency, you see these patients sporadically. You don't know when they're coming in. So it's not like you can go to a course and acquire that training.
Okay. Very interesting. I appreciate your response. Thank you.
Seeing no further questions, thank you for your testimony. Next up in opposition to Senate Bill 956. Seeing none, anyone here for informational purposes only for Senate Bill 956? Seeing none. Senator, any final comments?
I just appreciate the opportunity to have the bill heard, obviously, and appreciate all these witnesses coming forward. Thank you.
This will conclude the hearing on Senate Bill 956. Seeing no further business, I would make a motion to adjourn. Do I have a second? Second. All in favor say aye. Aye. All opposed, no. The ayes have it. We're adjourned.